Our mission is to inspire the people of Northwestern Ontario to give generously to advance our healthcare at the Health Sciences Centre. With this video, we'd like to share with you what has been accomplished at our hospital because of your generosity and why you should feel so very proud of your support.
Here at the Health Sciences Foundation, our mission is to inspire the people of Northwestern Ontario to give generously to advance our healthcare here at the Health Sciences Centre. And you have, both here in Thunder Bay and across the region. On behalf of all of us at the Foundation, I am pleased to be able to thank you to our donors and supporters for your generosity and for all you have done to ensure the best healthcare here at home for your family, your friends, and your community members. It's not enough for you to hear about the impacts of your donations from me and the Foundation. We feel it's best you hear it from the front lines here at the hospital, where all the magic happens. Join me now to hear from our friends at the Health Sciences Centre about the ways they have been able to improve the care and treatment of their patients with the equipment you have helped put in their hands.
Cardiovascular disease is now the leading cause of death in Northwestern Ontario. Your support for cardiovascular care has been overwhelming. You have brought angioplasty and vascular surgery here, and cardiac surgery is now on the horizon.
The desire of donors to help make both cardiac and vascular surgery a reality in Thunder Bay has been absolutely incredible. We are very grateful for your generosity. Thank you. I'm excited about what the future holds for us in cardiovascular care in Northwestern Ontario, and I feel very positive about the government's strong public commitment to the project. We look forward to celebrating the successful completion of the Our Hearts at Home campaign with all of our donors. And better yet, when cardiac surgery is being performed here, at home, that will be the real prize for all of us.
So here in Northwestern Ontario, we have twice the provincial rate of non-traumatic lower limb amputations. These are attributed to our high diabetes rates and rates of peripheral arterial disease. The biggest successes of the program, I believe, are in the numbers. Prior to vascular surgery, all of the aforementioned patients, including those who are obtaining vascular access and grafting, as well as vascular trauma surgeries, would have had to fly out for all of these procedures and surgeries.
Our program has grown tremendously over the years since it was first started. We're now doing about between 1,000 and 1,200 angioplasties per year. Our population is aging and we serve a very wide catchment area. And again, with our aging population, those numbers are probably going to increase as well. Our donors have been instrumental in allowing us to provide care. Before we had the cath lab, patients had to travel to Southern Ontario to receive this type of care. We have an excellent, capable, and very eager team, very professional, and we love nothing more than helping people and serving the people of Northwestern Ontario.
I will tell you without hesitation that the treatment that I received from every single person who attended to me in that hospital was just amazing. People ask often what it is as a patient that you want. What most patients want is they want their life back. I actually went back to playing hockey, certainly riding my bike, skiing, golfing. At the time this happened, I had no grandchildren. I can say currently now I have 5. How lucky am I to be here to enjoy that?
Everyone's life is touched by cancer, so we want to be sure we have the best cancer diagnosis and treatments available. Cancer care became and remains exceptional in Thunder Bay and across the Northwest thanks to you. Donors made cutting-edge tools and technology a reality at our cancer center so patients and their families can count on the best life-saving treatment here at home and across the region.
Our regional cancer program truly is a regional program. All of the decisions, plans are made with the patients who are living in the region in mind. We, in 2013, established an electronic medical record, which is shared with the 11 regional chemotherapy sites. The goal of the provincial cancer program is for patients to be able to receive care as close to home as possible. From the bottom of my heart, I would like to thank the exceptional, generous donors across the Cancer Northwest. Your interest, passion, and community involvement helped to make our program stronger. Thank you so much.
One of the biggest improvements we've had in the last 3 to 5 years was we implemented prostate brachytherapy. Previously, this was a treatment that you had to go to Southern Ontario for, and just the other day we treated our 100th patient locally. Otherwise, those 100 gentlemen would have had to go to Southern Ontario. About 10 years ago, we purchased new linear accelerators. we're just about to embark on replacing those ones. And also, because our patient volumes have steadily increased over the past about 5 years, we're actually at a treatment capacity. So we will be purchasing an additional third linear accelerator plus replacing our current two. Since technology has advanced so much, we have to replace our aging equipment to provide the best care possible.
All of those people through those doors, from reception to volunteers, to your doctors, to your nurses, and the blood work team, all of those people weave together to make an experience with cancer something that I could cope with daily. One step at a time, one day at a time, one procedure at a time. The people that work in the cancer center have a lot of heart. That seems like a good place for me to tell you how I feel.
World-class care is here at the Health Sciences Centre. Patients from across Canada and other countries come here for treatment from our urologists because of their expertise and equipment, some of which is only available here, made possible entirely by donors.
I was treated for an enlarged prostate. They did an ultrasound, and a normal prostate weighs around 20 grams, and mine weighed 120. And it was causing bleeding, clots. Dr. Almansi approached me for doing the surgery and put me on kind of a wait list. I went home without a catheter, which was great. It took me about a month to recover, and about 2 months to be fully confident. And now it's just like it never happened. It's great. It is life-changing, I've got to say.
I would like to thank the generous donors and the public support. The last 5 years were great for all of us. We're able to purchase 2 of the most advanced laser technology in the world. Our patients now go home same day, without catheters, without tubes, with minimal pain. The other thing we're able to purchase is the Trilogy machine, which is one of the most advanced machine to treat very larger kidney stones that laser is not able to treat it. And we were the first in Canada to purchase this machine through the donations.
When I started here, I started finding that many of the patients have been having this issue. To try to remove a scar tissue and to try to augment it or make things bigger is very, very difficult. And this is where, as a team, developed this kind of technique where we usually take grafts from the mouth and we put it to make the urethra bigger. And I remember my first patient who I told him, I cannot be 100%, but this is something that I think it should work. After him having such a hard time for so many years, multiple surgeries, dilations to try to make the opening bigger, we did the surgery and it worked very, very well with him. We have more than 90% success rate in this procedure. The reported rate in literature is like 50%. There are procedures done in Thunder Bay that are not done anywhere else, and they change people's lives, and that's why people keep coming from everywhere.
The Health Sciences Center's smallest patients have a lot to thank you for. Children require a special kind of care, and donors meet their needs with a constant flow of support. The infants and children may be too small to know all that you do for them, but their family members and staff at their bedside sure do. From the smallest items like bottle warmers to the life-saving incubators in the NICU.
One of the most important or most impactful items that we received recently were MRI-compatible virtual reality goggles. We can use it during the test to help to keep the children distracted. They're required to lay still for a lengthy period of time, so often it can be challenging to get children to be able to get through it without having to give them sedation and other things. Our team in the diagnostic imaging department are extremely grateful for having this addition. We have a very dedicated team that goes above and beyond for our patients. Having equipment to be able to provide care and to make their stay as comfortable as possible helps us to be able to do our job and helps to improve the experience that the patients and the families have.
One of the great additions that we've had through funding through the foundation is sleeper chairs. That allows our families to be comfortable and be part of the care at the bedside. Although it doesn't sound like a big deal, I just want to stress that it is a big deal. We want our parents to be comfortable. We see them as key players in the care of their child. So we often engage with our frontline staff and value their opinion of what equipment might be beneficial in helping them care for their patient and making the stay of the family a little less stressful.
So of course the staff are amazing at the NICU and we're so grateful the NICU's there. But we also have to thank the donors. Without the donors and all the money that they donate to the foundation, that equipment that helped these guys, breathe for the first few weeks of their lives.
It was because of the start that they got in our NICU that they can be so happy and healthy today.
I can't even imagine what would have happened if it wasn't there.
A hospital, in many ways, represents the beating pulse of a community. Children are born here, people are healed here, and sometimes it's where we say goodbye. But let's be clear, it is your hospital, and it is your pulse. And so with that, on behalf of everyone who serves here at your hospital, thank you from the bottom of my heart. Thank you for your donations. Thank you for investing in the future of care in your community. With your support, we are able to continually grow and build our hospital into a state-of-the-art facility where we strive for exceptional care for every patient, every time. Thank you. Miigwech.